system, and we start from the mouth, and from the mouth you go to the oropharynx, which is the part of the pharynx that's behind the mouth, behind the oral cavity. That will take you down. This is the esophagus. Starting from here, the esophagus will go all the way as a tube, and then it will open to the stomach. Between the esophagus and the stomach there is a cardiac sphincter, which is a sphincter that's guarding, which is right here. This is a sphincter that's guarding the entrance of the food from the esophagus to the stomach. If it is closed, the food will not leave the esophagus going to the stomach, and it will open so the food goes to the stomach. And then you have the stomach itself, which is this whole structure. And the stomach consists of different parts. This part here is called the fundus. Looks like a curved structure, fundus. This part is called the body part here, and this part is called the pylorus. And at the end of the pylorus you have the pyloric sphincter, which is this sphincter here. So this is the pyloric sphincter that's guarding the exit of the food out of the stomach. So the stomach is leaving, the food will stay in the stomach for some time until it gets digested, and then it will leave through this pyloric sphincter. And it's called pyloric sphincter because it's sphincter at the pylorus, which is this part of the stomach. It will open and the food will go to the duodenum, which is the first part of the small intestine. So this part here is called the duodenum, which is the first part of the small intestine, from which the rest of the small intestine, if you draw like an imaginary line like this part here will be the second part of the small intestine, which is the jejunum, and this part here will be the ileum. So stomach, small intestine, large intestine. Stomach, what's the small intestine? First part is the duodenum, this C-shaped structure. It should be like this, C-shaped, duodenum. This part here up and more to the left, this is the jejunum. This is down and more to the right, this will be the ileum. The ileum will end up bringing the food after the food is being absorbed in the small intestine. The rest of the food will pass from the last part of the ileum and will go to the first part of the large intestine. There is a valve here, which is this part here, that's called the ileocecal valve. Ileocecal valve, the valve that's between the ileum and the cecum. And the cecum is this first part of the large intestine. So the food, or the rest of the food, after you get what you need, the rest will accumulate here in the cecum. And then, so this is the large intestine, the whole gray. So this is the cecum, which is the first part, followed by ascending, going up. This is the right colic flexure, which is called the hepatic flexure because it's close to the liver. And this will be the transverse colon. Here you see the left colic flexure, which is called the splenic because it's close to the spleen. And this will be the descending, and this will be the sigmoid. So you're going down. This is the descending colon, and this is the sigmoid colon. And again, because it looks like a sigma. And this will be the rectum. And the reason why they call it the rectum, because it is like a rectus, which is perpendicular. So it's straight. This is the rectum, and this is the anus, and the anal sphincters are going to be here. This is the internal anal sphincter, and this will be the external anal sphincter. The internal is involuntary. Once the food starts to distend, it will open. The external is voluntary, and this is a part that you can control to keep it open until it's the right time to go to the bathroom. This part here is called the appendix, and the appendix is nothing but lymphoid tissues coming together to serve this part of the large intestine, and it is hanging here closer to the ileocecal valve, or closer to the end of the ileum and the beginning of the cecum. So cecum, ascending, okay, and then descending, sigmoid, rectum, and this will be the anus. This is the liver here. This is the accessory structure, and this is the spleen. The liver, if you look at it from up here, you have a right and the left lobes. There's a ligament in between, but this is if you're looking from up or the front. If you're looking from the back or down, you have 4 of them. 1, 2, 3, 4. This one, if you look at it closer, you see 1, 2, 3, 4 borders. So this is called the quadrate lobe. And this one down here, this This one whole thing here. This is called the caudate because it has a tail, which is the coda. So this is a caudate lobe. Right, left, quadrate, caudate. This is the gallbladder. And this is the cystic duct, meaning coming from the cyst, which is a bladder, cystic duct. Those two here are the right and left hepatic ducts. So the bile will be manufactured in the liver, go through the right and left hepatic ducts. This is a common hepatic duct. This is cystic duct. They will join together to make the common bile duct. The common bile duct, you don't see it, but it's underneath, disappearing underneath the duodenum, and you see it reappearing here. This is a common bile duct that will open here at the duodenal papilla, right here. This structure here is the pancreas, and this is the pancreatic duct, head, neck, body, and this is the tail, and this is the pancreatic duct. This is the main pancreatic duct, and this is the accessory. Both of them are going to open to the duodenum anyway, but this will open in a small puncture here, and this will open together with the common bile duct to an opening here, a larger opening here. This part here that's beside the caudate lobe is the inferior vena cava. You just see part of it here. Okay, now we're looking at the torso model, and it's showing basically same thing, it just looks a little bit different. This is the esophagus, and the esophagus will go through the diaphragm. This is a diaphragm that's separating the thoracic cavity from the abdominopelvic cavity. And you see here, this part here, this is where the esophagus exits, leaving the diaphragm and entering to the beginning of the stomach. Here is the stomach, fundus, body, pyloric sphincter, and the pyloric sphincter will open to this, which is the duodenum. So, and this part that you're seeing here is the jejunum and ileum, and you can like make an imaginary line like this, and this will be the jejunum, this will be the ileum, same thing, it will open, ileocecal valve, ascending, right colic flexure, transverse, left, descending, sigmoid, and so on. And here is the pancreas. It just looks a little bit different. And here is the liver that's showing the lobes that we talked about. Here is the right, here is the left. Now the caudate and quadrate. You see this is beside the gallbladder. 1, 2, 3, 4 borders, quadrate lobe. And this one is the caudate. See, it's giving you a tail here. So this will be caudate lobe right beside the inferior vena cava. This is the gallbladder, cystic duct, right and left hepatic ducts will join together to make the common bile duct. The purple is the hepatic portal vein, and the red will be the hepatic artery. Pause. Okay, this is another model showing the liver. If you look at it from the front, you can see the right and the left. Obviously, the right is a lot larger than the left, and this is like this. So right and left. This is an actual body. So right lobe is way larger than the left lobe, and if you look at it from the other side, this is cut section. So we removed parts so you can see what's inside. And if you look inside, you see 4 colors: red, blue, purple, and green. The red are branches of the hepatic artery. The blue are branches of the hepatic vein. The purple are branches of this, and this will be the portal vein, also called the hepatic portal vein, but you have to put portal to make it different than the hepatic veins. So the blue is hepatic veins, and this is the hepatic portal vein, and this is completely different. The hepatic veins take the blood from the liver and take it to the inferior vena cava through this. This is the hepatic vein entering to the inferior vena cava, this and this. So this is draining the liver and bringing the blood to the circulation, to the inferior vena cava, to the heart. But this is completely different. This is taking the blood containing food that's been absorbed from the small intestine to the liver. So it's completely different. This is the purple one. The green, this is the biliary system in general, and it's going to make the liver make the bile, go through all these biliary system, biliary tracts, and it will gather at the right and left hepatic ducts that we talked about before, that will go through the cystic ducts, be accumulating or staying stored in the gallbladder, and when you eat, the gallbladder contracts, pushing this out. That will leave through the common bile duct, as we saw before, that's going to the duodenum to gush the food with the bile that help in the absorption a digestion of the fat. And that's the importance of the gallbladder. It's not to make the bile, the liver make the bile, but the gallbladder store it. It's a set that store the bile, and when you need it, it will contract, pushing the bile to the duodenum, so it, and it will help the digestion of the lipids. Pause.
Start.
Okay. If you're looking at this model here, this is a cut section from the lumen of the or the wall of the small intestine, and what you're seeing here, these are the villi. These are extension from the mucosa. So this is called the mucosa, submucosa, musculosa or muscularis mucosa, and this one here is the serosa. Mucosa, submucosa meaning under the mucosa, musculosa or muscularis mucosa, serosa. 4 layers: mucosa, submucosa, musculosa, and this is the serosa, which is the outermost layer. If you look at these villi here, you see the green. These are the lacteals, which are modified lymphatic capillaries that will help in the absorption of the fat. The carbohydrates and proteins will be absorbed just a regular way through the wall of the intestine and goes to the veins, the portal circulation, and it will go through the to the liver and then will be distributed. The lipid has a different route. The lipids has to go through the lacteals, which are modified lymphatic capillaries, and it will gather together to go to the lymphatic system, go to the heart, and then will circulate to the liver. This red here, these are the systemic capillaries, the regular capillaries. So, and you see the lymphatic capillaries are a lot larger. The diameter is larger and it's wider and irregular if compared to the systemic capillaries. If you go to the next part, this is the arteries, small arteries or arterioles, and these are the venules. If you go to the submucosa, you see a cut section of what we talked about, plus this is a section of an artery, this is a section of a vein, and then we go to the musculosa, and the musculosa or the muscularis mucosa, and they used to call it musculosa, but now they call it the muscularis mucosa because they found another layer of muscles here that's called the muscularis mucosa, and this is the layer in between the mucosa and the submucosa. So there's another thin layer of muscle here that's different than this one. So now they call this the muscularis musculosa, and it's 2 layers. It's always the circular one, which goes like this in a circle. This is always the inner, and the longitudinal is always the outer one. And this will be the connective tissue covering the whole thing, which will be the serosa. And anytime you see green in the intestine specifically, this will be part of the lymphatic system. These are the glands here, the intestinal glands, Krebs glands, and these are the villi.